Hello and welcome to my shed. Today we're talking about pulses. Before we start, let's think what the pulse is. If we represent the artery with this red tubing, a pulse is when we can feel a small expansion in the artery with each heartbeat. So when we get an increase in the blood pressure in the artery in systole, the artery expands slightly, and then in diastole, the elasticity of the artery reduces its diameter again. So it's a fairly subtle change which we're trying to feel in that artery with each heartbeat. So in view of that, we want to try and get everything in our favour so we can feel the pulses as easily as possible. If you represent the skin with this piece of cloth, if the artery is quite close to the skin, we hopefully could feel it. However, if the artery is fairly close to the skin, but just sitting on a big, thick, lovely, soft, compressible layer of fat, like my tummy, then when we press on the artery, we probably won't be able to feel the pulse very easily, because all that's going to happen is that artery is going to expand into the fat each time. So we may not be able to feel the pulse at all. It's pretty obvious if the pulse is below a thick layer of fat, then again, we're not going to feel that artery. So ideally, we want our artery to be sitting against something fairly firm, like bone, and have a fairly thin covering over the top of it. And if we can compress and gently press that artery against the firm bone, then we're going to feel that expansion coming back up against our fingers. And the pulse should be fairly easy to feel. So why don't we have a look at the skeleton to see where those pulse places might be? So here I've represented our pulse points in the skeleton with this red electrical tape. Let's start from the head and work downwards and go through each one of those pulse points. The first one is the temporal artery, where we can feel the pulse in the artery against the zygoma or the temporal bone. It's fairly thin skin. The artery is small, but because it's quite superficial and up against the bone, then it's relatively straightforward to feel. So let's look at how we're going to feel that. We're going to place 3 fingers roughly along the length of where we think the artery is and hold them there. See if we can feel the pulse. You've got to hold them still for longer than the beats happen, otherwise you can miss it. If you can't feel it, gently move it to one side and back again, and then once you can feel the pulse, then count it. If you use 3 fingers, you're more likely to pick up the artery. Further down in the neck, we've got the common carotid, a really big artery about the size of my little finger, but because it's deep in the neck, it can be quite hard to feel. And here we need to compress it gently against the transverse processes of the cervical vertebrae. Remember to only press on one side at a time, because it's really uncomfortable. If you're pressing on both sides of the larynx or the trachea, it's quite uncomfortable. But also, you don't want to press and compromise the blood supply to the brain by occluding both arteries at the same time. But you shouldn't be pressing that hard anyway, but just one side at a time. So let's leave the head and neck and go to the upper limb. In the upper limb we've got 2 pulses to feel for. One is the brachial artery as it comes across the anterior part of the cubital fossa. It's quite deep on the antecubital fossa and sometimes it can be difficult to feel. but the brachial artery is the one we can listen to whenever we measure the blood pressure. So your cuff goes around occluding the artery, and then you're listening for when you start getting that turbulent flow between diastole and systole. You're going to put your stethoscope over the medial aspect of the antecubital fossa, and you're going to listen to the brachial artery. If we go down the arm, we've got the classic artery which we feel, which is for the radial pulse. And here we've got a fair size artery, which is superficial, with a little tissue around it, right up against the distal radius. And this is one we always classically feel for when we're feeling for a pulse. And you have the 3 fingers along, gently compressing it against the anterior surface of the distal radius. That's your radial pulse. So now let's go to the lower limb. In the lower limb, we've got 4 pulses you want to feel for. The first one is the femoral pulse, and we find that halfway between the symphysis pubis and the anterior superior spine, just below the inguinal ligament. And we can compress the femoral artery against the anterior part of the hip joint, or the acetabulum. You can feel for that there. The other ones are behind the knee and the foot. So let's just remove the leg and have a look at those. The first one we come across is the popliteal artery in the popliteal fossa. The popliteal fossa is quite deep, so even though the popliteal artery is quite big, it can be difficult to feel. The way of feeling that is to gently bend the knee slightly and release the tensions in the soft tissues behind the knee, and try and gently compress the popliteal artery against the distal femur at the back of the knee joint. Sometimes a tricky one to feel. Further down the leg, in the foot, we've got 2 more pulses that we can feel. The first one goes behind the medial malleolus, posterior to that, and that's the posterior tibial artery. Here we've got relatively thin soft tissues, an artery close to the bone, and if you compress this gently against the talus, you may be able to feel the posterior tibial, or you should be able to feel it fairly straightforwardly. In the front of the foot, we have another artery. We have the anterior tibial artery, which then becomes the dorsalis pedis. The same tube, just further on its length, it changes its name. And here, if we gently press against the bones of the tarsus, or against the second metatarsal, we can feel our anterior tibial pulse, or our dorsalis pedis pulse. So those are our pulse points from the head through to the foot. Remember the principles. We want a reasonable calibre, good size artery. We want little soft tissue coverings over the top. We want it to be going across a bony prominence so we can gently feel the force against it. I hope you found that useful. We need to get our friend back in the closet. Come on then, off we go. Oh, settle down, come on. Good night.